Who was caring about Mary? Mary was the mother of two boys that begin with pain in her ankle. She can stand for more than 30 seconds because of the pain. After 7 days, she go to a neurology specialist in this kind of peripheral injuries nerve, and he really didn't know what she has. Indeed, he ran out of the case. He didn't answer anymore the phone when she called him back because of the pain in her ankle. On the 10th day, a bluish blister under the nail of one of Mary's fingers, as well as a similar blister on the sole of her right foot. Later that day, her right ankle began to swell, and I realized that her failure to move her foot was likely to have resulted in clots in the veins of her leg. After that, an internist diagnosed her with thrombophlebitis and required admission to the hospital. In the exams, Mary had an elevated white count of 80,000, normal was 4,000 to 10,000, and there are 39% of eosinophils, or over 7,000 eosinophils. She was having an allergic reaction and she was taking just penicillin. Mary suddenly noted the onset of sharp right side chest pain that was made worse by taking a deep breath. Then she caught blood. A clot from her leg having right up her lung. The lungs can confirm a right-sided pulmonary embolism.
If you are immobile for an extended period of time because of surgery, pregnancy, illness, or travel, you may be at risk for deep vein thrombosis, or DVT, a condition where a blood clot forms in a deep vein in the body, typically the leg. Unlike arteries, which rely on the heart to force blood through them, veins transport blood with the help of muscle contractions while you move and walk. Veins also have valves that keep blood from flowing backward and pooling in your arms and legs. When you are immobile for an extended period, your venous circulation slows down. As a result, clotting factors in the blood may cause the slow-moving blood to clump together, forming a blood clot or thrombus. This condition is called deep vein thrombosis, or DVT. Common symptoms of DVT include swelling of the leg or a vein in the leg, pain or tenderness in the area, increased warmth in the skin, and red or discolored skin. In some DVT cases, a blood clot may detach from a deep vein and join the bloodstream. The clot travels from the deep veins of the leg, through the veins of the abdomen, into the heart, and finally lodges in the pulmonary artery or its branches, blocking blood flow to the lungs. This condition, called pulmonary embolism, is very serious and may permanently damage a portion of the lung.
The heparinase dose had been subtherapeutic. Her partial thromboplastin time had only reached 41. To achieve proper blood thinning, this value should have been up to 70. Follow-up blood tests that day revealed eosinophil count of 30,000. 2 days later, the senior resident called and he reported that Mary had developed a new type of chest pain. Her electrocardiogram revealed that she had suffered a myocardial infarction, a heart attack. After that, Mary was transferred to an experienced cardiologist and she was in the intensive cardiac care. The X-ray revealed that the chest dome was totally white, indicating her lungs were filled with fluid. The next day, she was breathless and with 100% oxygenation mask. And then the cardiologist decided to intubate her because her oxygenation dropped to 80%. She developed hypotension, requiring 3 vasopressors. Also, her kidneys shut down and no longer were producing urine. These findings all indicated imminent death. Mary needed corticosteroids to alleviate the inflammation. The renal specialist began placing an hemofiltration unit to draw fluid from Mary's lungs. As he placed the catheter in her artery, her heart stopped. After 2 minutes, her heart restarted. As the renal doctor again tried to place the hemofiltration unit, her heart again stopped. As the team pumped on her chest, and her heart returned again. Over the next 24 hours, she excreted over 4 gallons fluid. Her lung cleared and she subsequently fully recovered with the help of the intensive care unit. Physicians have performed a miracle. At the end, all these problems were produced by a bad medical service because she was receiving bad care with the interns after the neurologist left the case. The cause of the pulmonary embolia was caused by the therapeutic dose of heparin. She needed more dose, and all this caused her the next problem. All this problem was caused by medical distraction.
So we're going to continue straight on from the last video detailing how the coagulation cascade works. Heparin is a cofactor for the activation of antithrombin. This acts on many points in the coagulation cascade, inhibiting factors 12, 11, 9, as well as 7 and 2A thrombin. So you can see it works on all parts of the coagulation cascade, the intrinsic, the extrinsic, and the common pathway. Heparin has a quick onset but a short half-life, so it is most useful clinically for situations where you require immediate anticoagulation, for situations such as a pulmonary embolism, acute coronary syndrome, a myocardial infarction, or deep vein thrombosis. However, it is also used in pregnancy for anticoagulation because warfarin cannot be used in pregnancy as it's small and crosses the placenta. When you give heparin, it is useful to monitor the PTT or partial thromboplastin time.